This is a story about the future of healthcare in the emerging network age. The story starts with Denise Simpson, an experienced doctor. Denise is worried about the rates of treatment errors that occur in hospitals. Lately, she has been thinking about the data in healthcare systems. Patient history and treatment details are scattered across several systems, and there is no clear-cut path for obtaining access to the latest information. Data inconsistencies between systems are common. Sometimes the name of a patient is spelled incorrectly. At other times, treatments are only recorded in one system. In particular, if a patient has moved house a few times, it becomes a challenge to obtain access to all relevant data. This is where the story starts to get interesting. Denise receives a call from Paige Baker about a request for an appointment. Paige has just moved into the area. The local medical practice management system has no record of Paige's medical history. Before being able to give an appointment to Paige, Denise needs to record her full name, and she also needs to ask for address and telephone details. The process is time-consuming and error-prone. A single mistake in the recorded telephone number makes it impossible to contact Paige in case the appointment needs to be rescheduled. Denise described the weaknesses of the medical practice management system to her friend Ian. Ian smiled. Working for a software company, he had solved these kinds of data management problems for several supply chain companies, usually with the help of the cell platform technology. The solution involved putting customers in control of their own information, for example, contact details and information related to their specific needs. Customers grant access to their data by giving suppliers an electronic key to relevant pieces of information. Denise thought about this for a while and realized that the communication between healthcare organizations, medical practices, and patients amounts to an information supply chain which revolves around patients and their medical history. If the cell platform technology can reduce error rates in complex supply chain organizations, it may just as well be capable of reducing the administrative workload and the error rates in medical practices. Denise needed to find out to what extent this approach could be used in her specific context. Ian explained that data problems can often be traced back to the procedures and systems that are used to capture data. In particular, if the systems are used by many people from a range of professions involving a range of different terminologies and technical standards. Denise thought about the typical workload of a hospital or a large medical practice, where hundreds or even thousands of patients are treated on a daily basis. The cell platform technology ensures that each word or observation that is entered into a medical system is checked for consistency with all the data that is stored in a patient's personal medical data file. Most importantly, the cell platform technology ensures that Paige only has one personal medical data file, and that this file is accessible via the internet by all medical practitioners that have received an electronic key from Paige. Furthermore, the cell platform technology automatically checks that all records comply with technical medical standards, which allows different medical professionals to access the data in their preferred language, without any risk of human translation errors. Now Denise understood why the traditional way in which patient information is managed results in so many errors. Whilst each healthcare provider has a system to manage patient histories, each system keeps independent copies of the data, and since the systems do not exchange data continuously, the currency of information can never be guaranteed. Cell platform technology would eliminate duplication of information. At the same time, it would allow Paige to give any medical practice access to her latest medical history via a small mobile app in 2 simple steps. Step 1. Selecting the medical practice from a list based on her location, and Step 2. Pressing a button to grant access to her data. To learn more about S23M Healthcare Consulting or the cell platform technology, visit www.s23m.com.